All right, so today we're going to walk through the assessment timeline, important dates, and roles and responsibilities at both the LEA and the school level. We'll talk about the tools that you'll use to plan for, administer, and monitor the assessment, as well as to see the results. And then we'll have a quick Q&A at the end. So the Health and Physical Education Assessment is an outcome of the District of Columbia's Healthy Schools Act of 2010. The Healthy Schools Act of 2010 requires that OSSE collect and report performance on DC health and physical education standards annually. And so we test annually for students in grades 5, 8, and high school, and we test students in high school only during the year that they're enrolled in a health class. It's also important to note that the HPEA, or the Health and Physical Education Assessment, as well as other specific requirements of the Healthy Schools Act, are considered, so the HPEA is considered when OSSE is making grants that involve the Healthy Schools Act funds. So that might include things like school garden grants, health education and physical activity grant, and others. A bit of history about the HPEA. This is kind of a high-level timeline of the work that we've done together with LEAs to assess student performance. So in 2010, the Healthy Schools Act was passed. In the 13-14 school year, health and PE assessments were a part of DC CAS. In 2015, PARCC testing rolled out, and so OSSE instituted a bi-year for the health and PE assessment to allow schools to focus in on administering PARCC. The 2016 school year, the new health and PE assessment was administered. This was 15-16. And after that school year, we accepted feedback from LEAs both around the questions and the structure of the administration, which helped us roll out the 2017 assessment. That year, we built a tool in Click that allowed LEAs to track more easily the completion of the assessment, as well as pretty quickly get to results from the assessment. And we'll talk through that here momentarily as well. This year will be the third year that we administer this new iteration of the HPEA, and we're working on updates for next year as well, which I'll tell you more about shortly. This is the assessment blueprint. It hasn't changed since last year. What you're seeing here is grade 5. The blueprint is the same for grade 8 and high school. The 7 categories listed here correspond to the health and PE standards. SurveyGizmo, which is the online tool we use to administer the assessment, will randomly select 3 questions for the student to answer from each of the 7 categories for a total of 21 questions. Next year, we plan to develop new questions to expand the assessment item pool and increase the number of questions in each of these 7 sections from their current 3 up to 6. So that'll expand the assessment from 21 questions to 42. And we think this will be a more robust version of the assessment while still keeping it easy to administer and relatively straightforward. So as part of the question development process for next school year, we're also going to develop a pool of sample questions that we can share in the early spring of 2019 to help educators better prepare their student for the test. We have received a lot of feedback, a lot of requests for sample questions. We've been really limited in our ability to do that thus far because our pool of questions is the same pool that we use year to year, and we didn't build in extra, we don't have extra to share without actually sharing the assessment questions themselves. So definitely for part of our process for next school year, next assessment round, we'll have sample questions to share in advance. So before I dive into the platform itself and the tools, I'll walk through some important dates, as well as the roles and responsibilities of the LEA and school level folks. The assessment window is April 2nd through June 15th. LEAs can decide within that window when to administer the assessment, and we ask that you notify us of your planned assessment start and end dates no later than next Thursday, March 15th. And you can do that just by emailing osse.schoolhealth. Within that administration window, you as the LEA coordinator for the health assessment are tasked with setting internal deadlines for your LEA, setting a start and end date to the LEA's assessment window. Apologies, here's the right slide. The assessment window, regularly monitoring completion rates and following up with schools to ensure that you get as close as possible to 100% completion within your LEA. So last week you got an email from me that pointed you to a few resources on the OSSE website. If you did not receive this, please send a note to ossi.schoolhealth@dc.gov so that we have your contact information on file and make sure that we're connected. Your deadlines for submitting documentation to OSSI, also noted in that email last week, are March 12th and March 15th. By March 12th, you'll submit to us via box a roster of high school students enrolled in a health class during the 17-18 school year. This March 12th deadline only applies to LEAs who are serving students in grades 9 through 12. Then by March 15th, we ask that you email us your planned assessment dates. Also by the 15th, be sure to upload to Box your planned student accommodations. We do have online a template for both the accommodations list and the high school roster. And you can see that link here at the bottom of this slide. More important dates. On Tuesday, March 27th, you can expect to receive from us the test tickets. We will upload those to you through Box. These will be pre-formatted to a page to allow for easier printing and cutting. Your role is to distribute these tickets to the schools, and you can do that via secure electronic transfer on your end, or printing and pre-cutting them and delivering them to schools, your choice. The test tickets will contain an LEA, the LEA name, school name, student name, and then the 16-digit login code that allows the student to log in to the SurveyGizmo assessment online. When we're creating these test tickets, we take a snapshot through SLED of all grade 5 and grade 8 students, and we do that in a one-time snapshot on March 15th. For high school students, again, we ask that LEAs provide us a list of students who have been enrolled in a health class this school year. We're not able to grab that snapshot from SLED because we don't capture, SLED doesn't capture that information. So that's the one exception where we're asking you to send information to us. So it's really important because of this that you meet that deadline of March 12th to send us your roster of high school students so that we can turn around those test IDs. And the window for the assessment is again April 2nd through June 15th. So at the school level, what those roles and responsibilities look like is your school-based contact or proctor will confirm access to SurveyGizmo to the platform. So they should test the assessment link, which I'll provide here in a couple of slides, on the school computers that are going to be used for the assessment. And they should do that in advance of testing day, just to be sure that SurveyGizmo isn't blocked by the school's network, everything's functioning as it should. Proctors can work with their school's IT support to resolve any access issues, or give me a call or shoot me an email at ossi.schoolhealth so that I can connect you with help desk staff who can help. And as noted in the Proctor guide as well, SurveyGizmo is compatible with the latest versions of Google Chrome, Mozilla Firefox, Internet Explorer, versions 10 and above for Internet Explorer. At the school level, school POCs should also send home the sexual health exemption letters. We recommend doing that at least 2 days in advance of the assessment date. Those folks at the school level should also keep a list of students who will be exempt and make sure on the assessment date they have the list available and can verify that in the SurveyGizmo tool, which I'll show you shortly. One last note here about students. We do understand that students will be, sometimes do exit and enter schools after that March 15th date where we're capturing that snapshot in SLED, or the March 12th date when you send us your high school rosters. Unfortunately, we're not able to create test IDs for those students after that snapshot date. So we're hopeful that we can capture enough of the bulk of the students at every school. And unfortunately, we aren't able to track the movement around of students between March 15th and the early April start of the assessment. This is the sexual health exemption letter. This is just the last paragraph of it to show you here that when you access this from the OSSI website, it's in Word, and so you can change the dates here to dates that work for your LEA or for the school specifically. You can find this template on the OSSI website in Spanish, English, Amharic, Korean, Vietnamese, and traditional Chinese. So we'll move into the tools that you'll use to administer, to plan for, and monitor. And we'll talk about Box, Click, and SurveyGizmo. Box is a new tool that I bet you're familiar with using for other projects with OSSE for transfer of information back and forth. And if you're not, I'll walk you through a couple of screenshots here today to be sure it's clear. So we'll use Box to, for a couple of things. When you're submitting information to OSSE, as seen here on the right, you'll give us your high school rosters and your student accommodations. What you'll receive from OSSE through Box is assessment tickets, those 16-digit codes and tickets. This is a screenshot that's similar to what you'll see when you log in. So if you're looking at your LEA file here, you'll see your LEA name to OSSE, your LEA, and then the second folder you'll see is OSSE to your LEA. So for right now, when we're asking you to upload documents for us, you'll click on this first folder here. Once you're there, you'll probably see, or you might see, multiple folders for different projects that you coordinate with OSSE on. The one that you want to click on next is the Health and Physical Education Assessment. And then from there, you should see, it should not be grayed out like this. It should be, I think, blue, an upload button. So you should upload to this folder your planned accommodations. And if you're a high school or have high school, serve high school students, you'll upload the high school roster here as well. That's for uploading files to Box. For downloading files from Box, you'll click on the other folder when you back up a few steps. So from OSSE to, you do the name of your LEA. And then once you're in that folder, same process. You'll find the Health and PE Assessment folder, open that up, and you'll see your test ID tickets. Again, when you can expect those is March 27th. The next tool that we'll talk about is Click. As I mentioned, Click, we rolled out a Health and PE Assessment tool in Click last year. This year we'll be updating it. Access to Click is given out of the box to data managers for each LEA and should have been given to you as the health assessment point of contact this year. Please do contact me at OSSE.schoolhealth if that is not the case and you're not able to see the 2017-18 HPEA tool when you log into Click. So your role as a health assessment coordinator is to log into Click regularly during your assessment window to monitor completion rates. You'll be following up with schools once you look at those completion rates to make sure that you get as close to that 100% mark as possible. This is the login screen. Once you log in, you may have access to multiple different tools. You're going to find the Health and PE Assessment. It's actually going to say 2017-18. This is a screenshot from last year's. We actually are still updating Click for the 17-18 school year. So in a few weeks, I will do a really brief introductory webinar about Click itself. So stay tuned for that. But for right now, what you see here is similar to what you'll see for 17-18. What you want to focus on during the administration window for your LEA is this completion percent column here. It'll be, again, for 17-18. So you want to look at, of all fifth graders in your LEA, how many have completed, not started, or partially completed the assessment, and really look at that overall rate. From there, you're able to drill down within Click to see, okay, if only 10%, let's say, of my fifth graders have completed and 90% have not, and we're past the assessment window, let me follow up with that school and let them know what their completion rate is. And further, I can also send to that school a list of all of the students who we anticipated were going to take the assessment and delineating those who have and have not taken the assessment yet. So your role, having access to Click, means you can really closely monitor completion and follow up with schools. So Click's a pretty powerful platform. What I won't go into right now, and we'll cover a little bit more in the next quick webinar, is that in Click you can also pretty much day of or within 24 hours of the time that your assessment window closes for your LEA, you can log into Click and view the results. And so we'll go into that more in our next webinar. Okay, so the assessment platform, again, this year will be SurveyGizmo. Prior to the assessment, again, make sure that you can access this site. This link was slightly updated from the one that is currently in the LEA guide. So I will update the LEA and Proctor guides to make sure they have the correct link. But please do share this one. I can email it out as well. Again, Google Chrome, Mozilla Firefox, Internet Explorer all work for this. If you're using Internet Explorer 9 though or below, and you can't update your browser, we do recommend that you contact your IT department and make sure that your security settings and everything is set up right for this. Just make sure you're checking it in advance. Don't wait till the day of. That's the biggest piece of advice I can give you there. The survey, or the assessment that is, looks similar to this. You'll have a login page. You'll enter the student's assessment ID. The proctor can do this for the student, or the student can enter it themselves. That kind of depends on how you want to set it up. For the second portion here, has the student been opted out of sexual health items by their parent? Do have the proctor enter yes or no here, and instruct students not to click next until the proctor has come by and verified everything. So the proctor should have a list of students who've been opted out. So the proctor will confirm this and click next. It'll give you another chance to verify information. The way to verify is we'll have a student initials. So it'll be first initial, last initial, comma, first. It will show the grade of the student and then whether or not they've been opted out of sexual health questions. You'll click next. The student will click through, answer each of the sections. I didn't put screenshots in for that, but it's pretty straightforward. They'll answer multiple choice questions on each page and click next. Throughout the assessment, the student can click next and back and can check answers. Answers are saved as they go. Let's say a student starts the assessment and for any reason needs to stop and log off the computer. The assessment will save their answers up to that point. So if that student comes back the next day, logs in using the same code, their answers will be saved, as long as that student has hit submit on that page, that is. So once they've submitted all their questions, they can go back and review, come to this page at the very end, which is the confirmation page. So on this page, once the student clicks submit, answers are saved and the assessment is complete. And they'll get a notification similar to this, 100% completion, you're at the end of the assessment. There are a couple of guidance documents that you can use. I've mentioned them throughout this webinar. They're all on the website. The LEA guide as well as the Proctor guide and script. Again, we ask that you hand those out, especially the script, to your schools. Please contact me at ossie.schoolhealth with any questions along the way. And don't forget the dates. I'll actually pull those back up once more here. And with that, we can move to questions. And I'll open up the questions tool here. I believe we've got a couple already. Okay, the first question, will this PowerPoint be emailed to participants of the webinar? Yes, happy to do that. And we are also recording this webinar, so we'll post it on the website as well, the webinar recording. Okay, there's a question about where to get the sign-in for Octo to start plugging in names. Not sure I understand that question, so let me know if there's a sign-in for a specific tool that you're looking for. You can contact me if you need help accessing Box, where you can upload and download documents, which might be what you're asking. Okay, there's another question about, we have a Health 1 and a Health 2 class in high school. Should students in both classes take the assessment? Yes, I'd have them both take the assessment. With the caveat there, if students did take, if Health 2 means that those students took a Health 1 version of the class last year, and took the assessment last year, I can leave that up to you. I recommend having them take it. If they're enrolled in a health class this year, even if they took it last year, I think it's a good idea to have them take the assessment as Health 2 students. Couple more questions. What's the best format to upload the rosters? So we have on the website a template that you can use for that. We have, and actually I can pull it up here. I'll show you the template. It's an Excel template. It's not critical that you follow this exact, you don't have to have this exact formatting on the template itself, but we do just want these columns to match. So on this page of the OSSI website, we have a template here for the health roster, that's at the high school level, and then accommodations. So I'll pull up the health roster. So we have your LEA code, your school code, student last name and first name, their grade. And actually, I want to point this out here. I sent out an email yesterday for folks who are submitting high school student information. I need to update this on our website, but for this column, we'd like to have them separate. So there's a USI column and a date of birth column. That date of birth is really going to help us validate the student information on our end. So please don't leave that one out. Make sure date of birth is there and USI is there. So I will update this template on the website, and I sent out an email about this yesterday as well. So the template for, this was for the high school students, the template for the accommodations is pretty similar. And there's an instructions tab, both on this template and the other, that kind of walks you through how to set it up. Okay, looking for, let's see if there are any other questions. USI is, it leaves me at this moment, unique student identifier, that's what USI means. So your school should have that information on every student. It's part of their enrollment data. Let me know if you have further questions on that. Okay, I think I answered the question about student accommodations and where to find that. The link to Box, the Box tool is linked to in this slide deck, which I can send out. It's linked to from the emails that we've sent out the past couple of weeks as well. The word Box, I think, is just hyperlinked. If you click on that, it'll take you. And I can when I send out this slide deck, I will give you the full link too. Make sure you have it. Okay, thank you, everyone. I see now that folks were able to hear me earlier, and they typed it into the question box, which is, I was looking for information in the chat. So I apologize again for all the technical difficulties, and thank you for being patient. Okay, one last question, and I think that will be it. We can wrap up. February 27th was the date that I'd mentioned that schools should have received the Proctor guides, accommodations template, etc. If for whatever reason you didn't get that email, send me an email at ossi.schoolhealth just to be sure I'm sending all of this information to the right contact for your LEA. You can also find everything that I sent in that email is up on the OSSI website. The link for that is in this PowerPoint deck, and so I'll send that out to you as well. But do make sure you send me a note so that I know that I'm contacting the right folks. Okay, and with that, if there are no other questions, we can finish up. Please reach out with any questions. If you need advice on anything, if anything from this webinar wasn't clear, happy to help. Again, my name's Amy, and thank you for being patient, and thank you for joining this webinar, and we'll be in touch. Have a good day, everyone, and a good weekend.